Hello and welcome to the free webinar about MRCOG Part 3. And we'll be discussing a few important points related to the exam. Let me introduce myself. I am Dr. Rubab Khalid, and I did my MRCOG way back in 2018. And since then, I am mentoring and I'm maintaining a blog. And I hope all of you know me through that. And I have done my master's in medical education also, and I'm working as a consultant as well as full-time medical educationist. So these are my contact numbers where you can reach to me at any time. Let's quickly jump on to today's agenda for this free meeting, because since we got the exam results, I was getting a lot of queries related to MRCOG Part 3. So I thought it's better to gather all of you in one meeting and address those things. So first, we'll be talking about how is the exam format. I'm sure some of you have taken the exam previously and you are aware what's the exam format, but we'll look at it at a different perspective. So I hope that's going to be helpful to you. And then we'll see how to do a proper preparation for this exam, because there are a few things which are different than the part 1 and part 2. So I'll focus on those things. And then I'll explore a little bit in detail the domains which form the basic skeleton for this MRCOG part 3 exam. And then we'll have a model task practice for which Dr. Ayman has graciously agreed to volunteer. And then I'll be very happy to take all your questions. You are free to take the questions, write your questions in the chat box. And at the end also, we'll have the live interaction and live questions also. So once you pass the exam, and when you're taking any exam, the main thing you need to know is whether you are eligible to take the next step or not. So part 3, there are two main requirements from RCOG. Number 1 is that you must have passed your exam, the part 2, and you must have had assessment of training. So on the RCOG website, they always give a timeline to get your training assessment done. And after part 2, you can get the assessment of your training and then move on to take the part 3. And for that, you need to have at least 4 years of working experience in obstetrics and gynecology. And you send your documents, whatever is given on the website, whatever they require you send them, and then they assess it, and then they see whether you are eligible to take part 3 or not. That's a very important step, because if you are planning to take the exam, you need to keep an eye on the crucial dates, and I'll be talking about those dates also in a short while. So this is the training matrix which is followed in UK. And remember, we are taking a UK exam and we want to enter their system. So before you enter their systems, or you want to be able to show that you are up to the mark according to their trainings, you need to know this matrix. So there might be a possibility that you guys are working at a very senior levels in your current practices. Most of you are working as a specialist or as a consultant. But for MRCOG part 2, 3, you need to remember that this is an exam which is targeted at an intermediate training level. And you are supposed to be at a ST5 level. So why I am saying this? Because when you look at the scenarios in the exam, they are telling you that you are an ST5 working in so-and-so clinic. So you need to know who you are. So you are ST5. And this happens that if you are working as senior, so you are the one, you are the consultant, people are looking to you to deal with the complex cases. But for MRCOG exams, don't forget, when you are performing in part 3, that you need to involve senior people. You might need to involve ST6, ST7, specialist, or even the consultant. So there are people above you. So that's a very important step you need to understand, and you need to remember and not forget it during the exam. And that comes with the practice. Now the question comes, how to prepare for the exam. I would tell you that this is I think the easiest part out of all 3 parts of MRCOG. Part 1 and part 2, they are the written exams. And part 3 is basically all about the communication skills. And there are different ways to communicate. You need to listen actively. You need to be able to connect with people. You have to practice, and you have to practice a lot. Getting a feedback is also very, very important, because you keep practicing. No one is there for you to improve your practice, to give you the insight that how you are performing. Then your that practice is not going to work. Okay, so the first thing is you need to understand the exam, and this is the part of my first half of the session, that we'll be focusing that what is this exam about, and how are the domains tested, and so on and so forth. And you need to plan it very well, plan ahead of time. And you have to organize and collect the reading material. This is very different than the part 2. For the part 2, you need to have your GTGs, your talks, your nice guidelines, a lot of material. But for part 3, there are a little bit of differences. I mean, the modules which are tested are little less, and the approach towards the exam is different. Here comes the role of patient information leaflets, which you need to know, and main basics, like, the highlighted things or the bulleted points in the guidelines. Those things should be there, and you should be able to demonstrate that you are up to the mark and you can apply those guidelines, all what you have learned in part 2. Remember, it does not require a lot of what do you say, a lot of study time. All it needs is the way you talk and how you communicate. That's the important thing. Okay, and having a study buddy, that's a blessing. So if you have a study buddy who is aiming for the same exam, probably May or probably November, but still, if you have a study buddy, that's always going to be helpful to you. Now let's talk about the exam format. Because of the COVID, the exam was shifted online. Now the exam is being conducted physically, and that's the outlook of the exam, that you have the cubicles where you have the table and chair, and the examiners are sitting, the role players are sitting, and then you go in and you move in the circuit. It's a circuit exam. For few people, especially for those people who are from politically unrest countries where it's difficult for them to travel, there are travel restrictions. So for them, they can have the online exam, but now you need to know that the exam is face-to-face. And if you ask my personal opinion, I would rather suggest you that having a face-to-face exam is better, because I know there are some advantages of taking the exam online, because you don't have to travel. That saves a lot. But if you take the exam face-to-face, and if you have planned it properly, your body language shows a lot. Because sometimes if you get stuck up, or you go blank with any of the case, but your body language can cover those weaknesses. So it's up to you how you are going to tackle, and you need to find out which center is for you, which center is feasible for you, which center would be helpful for you to travel to, and how you will be traveling, how to arrange the visas, how to manage the family back at home. All those things should be kept in mind when you are planning for the exam. So now, what does the exam want from you? I have spoken about this previously also. This is the Miller's pyramid. I'm sure you have gone through this Miller's pyramid while preparing for part 2. So what does this Miller's pyramid indicate? That this is a pyramid which is loved by we medical educationists, because this is a pyramid which shows you how a person can become an expert. So what's your aim for MRCOG part 3? That you want to demonstrate, or you want to show the examiners that you are an expert in your field. You have showed them that you have the factual recalls, and you can interpret and you can apply the knowledge by taking the part 2. It's one step ahead. So this is something you need to keep in your mind, that this exam is not like the part 1 and part 2. This is a different exam. This is all about your communication skills. You need to be vocal. You need to talk, and you need to communicate. You should be a good communicator. Okay, and we'll see that how this can be improved, and it all comes with practice. If you practice, you're going to be a better communicator. Now, remember, this is a transitional journey from a written exam to the verbal exam. Okay, in the written exam, you can just sit down, you can just keep reading and just take the exam on the computer and just come out. But this is a different exam, okay? And this has to be a vocal exam. And there are total 14 tasks. I'll be talking about the tasks also in a short while. And the total time for this exam is 168 minutes. It is divided as 12 minutes for each task. 2 minutes is outside the cubicle reading the task, and 10 minutes for actual performance of the tasks. Okay. So what are the different types of the exam tasks? Total 14 tasks are there. There are 3 types of tasks in MRCOG Part 3. 3 types of tasks. Number 1 is the structured discussion task, and there are total of 4 structured discussion tasks. So what do we mean by structured discussion? In that, you have an examiner sitting inside the cubicle, and you go there and you are going to discuss in a professional manner. And here you have to talk in the medical terminology. I've noted down one thing regarding the structured discussion task, because we know that there are 10 role player tasks. So what happens over the past 5 years, I've noted it's a pattern of the candidates that they keep preparing for the role player tasks. But when the time comes that they have to perform a structured discussion, they forget that. And they start using the layman terms. And that's a big, a red flag for you, because this is going to make you score borderline or make you fail in that task. So be very careful, and you need to, first of all, read the task very properly and know whether it's a structured discussion, whether it's a role player task, and you need to prepare yourself properly like this before you enter the cubicle. Then comes the second type of task is the simulated patient task, and there are a total of 6 tasks like that. Now, and the other type is simulated patient with lay examiner. So let me first talk about the simulated patient tasks, which are 6. So in this, what is the setting inside the cubicle? That examiner is sitting there and a role player is sitting there. So when 2 people are sitting inside, you have to ignore the examiner. You don't need to go and introduce yourself to the examiner. Examiner is just sitting there as a fly on the wall. You don't need to look at the examiner. Just go and talk to your role player, start performing and start doing whatever the tasks you are, whatever the domains you are asked to, and just carry on your task. Okay. And so that means there will be 3 people inside the task. Now comes the most important type of task, in my opinion, and that is the structure, that's the role player or simulated patient task along with a lay examiner. So who are the lay examiners? So in these kind of cubicles, there will be a role player, an examiner who's actually marking, and another examiner who is just an observant. That lay examiner is not a doctor. Remember that. They are not doctors. They are just people from different fields of life. And they are assessing you for very important things, which we tend to, unfortunately, we tend to forget that we are very sound in our clinical knowledge, in our clinical grip, but we forget that we are being seen by the people as an overall impression. And the main thing in this exam, or the whole of the 14 tasks during the part 3, is that the examiners, what examiners are looking for? They are seeking only one answer. Is this the doctor with whom I can trust my loved ones? Will I take my wife, my daughter, my mother, or my sister to this doctor? Is this a safe doctor? Is this doctor making things simpler rather than complicating it? So that's the main answer the examiners are looking for. If you keep that in mind and prepare your exam like that, I'm sure you're not going to miss anything, and you're going to pass in the very same attempt. So now let's talk about the modules, as I told you. Now the RCOG, they have updated the curriculum in 2019 and in 2024 August also. Now they call the modules capabilities in practice or knowledge requirements, but remember they are actually a different name for the same things. And there are a total of 14 modules. On each task, one module is tested. They don't tell you what module it is. By reading the task, you have to identify which module it is from. And I'll talk about some themes also, and I'll tell you what are the important things to do. So first of all, you need to know your modules. Whenever you are preparing the modules, preparing for exams, go module by module. Dedicate some time, like for example, now my exam is just 2 months away, actually 2 months away. So what you should be doing is you should make a rough schedule of your preparation, that in those days you are going to practice this module and this many tasks you are going to practice from each module, and go along like that. Okay, so total of 14 modules are tested. And in part 2, if you remember, there were 18 modules which were tested. But here there are 14 according to the task. And the main thing is you need to identify which module the task is from. Then comes a few of the practice books, and these are the books which are available. And I would say that they are very good books, especially this book, Lisa Joy from RCOG, because this is a standard book. This is from RCOG, and they have RCOG has this on their e-learning site. They have provided the the model videos also. So I would it's strong recommendation that get access to that and watch those videos as many times as you can, because those videos are going to be helpful for you to understand how the real exam happens. Okay, and the other books also take maximum scenarios from all the books. And I would say that just one thing I want to add here. So many people, they are when they're preparing for the exam, you are going for the previous exam questions, which are famously called as recalls. I tell you, it's not bad to go for those recalls, but my advice for you, an honest advice, is that don't get into the trap of recalls. Rather than that, focus your preparation according to the modules, according to your ability to, so that you can tackle any task provided. Because if they change a single word from here and there, the task becomes totally different. So don't solely rely on the recalls. Please follow the standard books, have the practice, get the feedback, improve yourself, and then you are ready to tackle any task. Even if you have not even seen that task ever, you'll be able to manage. Okay, so now these are the books. You'll be collecting those. This is the most important one, exam calendar. So if you are planning for exam calendar, so now you see those who are going for May exam, I'm sure that you must have had your assessment of training done, and you need to keep an eye on the RCOG website that the bookings will be starting from 6th March, and priority booking will close on 10th March. Second booking window will open on 13th March, and these are the exam dates. You must know what's the venue for you, how you're going to do. And when the exam booking opens, you get the email for the exam booking. Please do the exam booking on priority basis, because the seats get filled in no time. Keep a good internet connection, keep a laptop with you, keep your cards ready with you, and so that you can book the exam as soon as the booking window opens. Another tip here is, sometimes it happens that you are aiming for a specific center and the seat is not available in that center. So I always say that the world is open to you in front of you in the window across the globe. So wherever you get a seat, just grab that seat and book your exam. The other things can be sorted out later on, because so many times I have seen with I'm talking with the experience. So many times I have seen that People have to drop out because of certain reasons. So there may be a possibility that you have chosen a seat in, let's say that you are from Pakistan, you don't get a seat in Pakistan, you have chosen a seat in Dubai, right? Someone has dropped out from there, from Pakistan. So you can, the seat becomes vacant. So the college will prioritize you. You can write to them. And if you can't make it, you don't have visa or you have any problem, you can always write to the college in time, in the deadlines, in time, and inform them. And sometimes these things works in, blessing in disguise sort of a thing. So just grab the seat and later on you can sort it out. And here is the exam calendar for the November exam, because those who have passed just in January exam, you can either take the upcoming May exam or you can take the November exam. But whatever you do, you have to start preparing from now onwards. Okay, just start prepare as soon as you get the results. That's the best strategy to tackle the exam. So you need to keep these dates also in mind. Now I'll just talk quickly what to do outside the cubicle, the 2 minutes. And I would say that these 2 minutes are going to decide how your task is going to be. Okay, so you are standing outside the cubicle. So there are a lot of papers displayed. So those who have taken the previous exam may have noted that. So what you have to practice is that you have to be a fast reader. Not only a fast reader, but also you need to read carefully and focus on each word and identify the module. First of all, identify which module this task is from. And if you identify that module and you apply that module mindset to that task, half of your job is done. Trust me, half of your job is done. Because it happens sometimes, like for example, if it's a maternal medicine task, and so in the maternal medicine, you need to have, there's a specific template for maternal medicine. You need to talk about the disease effect on the pregnancy effect on the disease, the contraception, how the future will be taken and all that. But if it's a labor and delivery task, it's basically the labor and delivery task. So main focus would be how you would be delivering the patient, not the counseling. So if you identify the module and then you identify the theme. So in the next slide, I have given you a few themes or around which most of the tasks are built. So there are a few themes. So you need to identify what's the theme. And then if you identify this during this 2 minutes, you're done. So how you are going to divide your 2 minutes? You spare 1 minute for reading what's given and 1 minute for taking an outline. Make a rough introduction, like have an introduction in your mind. Okay, what's the name of the patient? What's her age? Why she's there? And make an agenda. Okay, you have identified this is a Breaking Bad news station. So you make an agenda that you're going to follow the spikes module, how you're going to break the bad news, and then just have an overview and how you're going to enter. And remember, if you cannot read all the papers in those 2 minutes, do not panic. All those papers will be displayed inside the cubicle also. So, and you can just have a look at it also. Even if you have not read finished reading, if you entered, you just introduce yourself and you need to read, just tell that, give me just 20 seconds. I'll just go through this. No problem. And you have a paper and a notepad, so you can take notes on it, the important thing, and just write the patient's name and age so that you do not forget and you do not confuse yourself, okay? Now, here are the various themes which are commonly tested in the exam. Breaking bad news in case of miscarriage, fetal anomalies, malignancies, dealing with an angry patient. And that's also like, once you read the task, you know that you are going to deal with an angry patient, and your body language and the way you tackle that task is totally going to be different. And how you, I mean, there might be just a simple explaining a diagnosis sort of a task. And I would say here, mainly for especially in the oncology module, most of the times you are all what you are expected at the level of ST5 while you're taking MRCOG exams. You are expected to know everything about the disease, right? You might not be expected to do a vulvectomy or a radical hysterectomy. That's not your level. That's going to be done by a senior person. But you must know what all the steps are involved and how you can communicate and talk about this to the patient. So that's important. And consent, very, very important. The consent advice papers and patient information leaflets. Consent advice papers must be on your fingertips. Why? The reason is, in UK, people who are being trained in UK, they are using those consent advice papers on daily basis. So they have those numbers, they have those risks on their fingertips. So you need to be very, very meticulous, and you need to revise those papers very carefully so that you can talk about it. And in this, sometimes you can get a Jehovah's Witness who refuses blood transfusion, and that becomes a challenging task for you to show your skills. Then maybe there may be some counseling stations like lifestyle changes, and that's also very challenging and tricky counseling sometimes. And handling a complaint, that's very, very important. The patient might be angry with you, and how you can accept your error and guide the patient, and you need to keep yourself calm, quiet, and just know how to escalate the anger of the patient. So these are very important. Then there may be, it's written domestic violence, there may be some hidden agendas. Patient may come with some repeated complaints, but actual complaint or actual problem is something else. So you need to know about that as well. Some interpretation of the investigation reports and communicating it to the role player, or maybe you have interpretation of other investigations, so you may have a structured discussion, or you may have interpretation of some investigation reports at a teaching station. Anything may occur. And risk management and patient safety issues, talking about the incident reporting, never events, and so on and so forth, right? So these are the various themes, and these themes you will be identifying while you are outside the cubicle. Now comes the main performance, I would say, inside the cubicle. So what do? You have, first remember, you have 10 minutes, and you need to divide your 10 minutes. You start with the introduction and you set the agenda. And this is to be done within 1.5 minutes. Introduction, 30 seconds, agenda setting, maximum 1 minute. 1.5 minutes, you need to introduce yourself, set your agenda, and then you have to, first, when you read outside the cubicle, you need to identify which domains you are going to be tested on and work on those domains and structured approach towards the domains. If you are, patient safety domain is included in all the 14 tasks. No task is complete without patient safety. Remember that. Other domains, maybe there may be 3 domains, 4 domains. Remember the domains also which you are going to be tested on. And acknowledge the patient's concerns and address it. Keep pausing and checking the understanding, whether people are with you, they are understanding or not. Summarize at the end and provide further resources, patient information leaflet, support groups, and then conclude the task. So how I would say that you're going to divide the time. So once you have set the agenda, you start the open consultation with the open question. Give 4 minutes, round about 4 minutes for information gathering part, taking your history, talking about those things, and spare last 5 minutes. Last 5 minutes, so you can talk about the management, actually what you're going to, what you're supposed to do. If 5 minutes have crossed and you are still information gathering, or if you're still taking the history, that's going to be a problem for you, because it's so difficult to conclude the task in the end then. And right after 8 minutes, go towards the closing, because you have to move to the next cubicle. You have to conclude your task. You don't want to leave the things unfinished, so that you can move. So that's how you decide and divide your time. And when you're practicing your task in the beginning, probably you can practice the tasks without timing, maybe 10 minutes, 14 minutes, it's okay. But later on, you need to keep brushing so that you know that what is to be excluded, and you should be able to finish your task within the 10 minutes when you are practicing for exam. And the consultation model, it's provided in the course for obstetrics, and for the gynecology, there are different models. There's a specific consultation model which you need to follow. There is a pattern which is followed for exams. So now let's quickly go through the domains. I'm sure that all of you know that these are the 5 domains which are tested in the exam. But how are these domains marked? What is the marking scheme? So these are the marking scheme. So it depends. Once you have the task, how many domains are there? And if you score 2, that means you have passed that particular domain. And if you performed borderline, you will score 1. And if you fail a particular domain, that would be 0. And you do get the results your domain wise, and they tell you that if you have passed, you will get a congratulation letter. I'm sure all of you will get it very soon. And if you can't, unfortunately, if you can't make it, they'll give you a little bit of feedback that what are the domains you need to work on, and you need to work on those domains. I tell you something, you might think that the next slides, which I'm going to discuss, what am I discussing? Why Dr. Rubab is discussing all those things? We know these things. I'm aware that since some of you have taken the exam, you are aware of these things, but you need to know that this is the foundation of your exam. So there is if you cannot reach the standard or required score in a certain domain, there is a reason for that, and there is a way to handle these domains. And this, with practice, it becomes it's so coherent that once you are performing, and if you're about to pass, you don't even realize that you touched that domain, but actually you have actually done. So let's start with the most important domain. For each domain, I made 2 slides. So the most important domain is patient safety. And so patient safety is everything you are doing in your task. Name and age confirmation. This starts from there, and informed consent. When you are examining the patient, chaperone should be there, documentation of allergies, the blood transfusion reactions, maintaining the confidentiality, assessing the mental capacity, prescribing safe medications, appropriate contraceptives, safe handovers. So this all makes part of patient safety. So there are some things, sometimes some candidates or some doctors, they can make some mistakes if they don't understand the principles of clinical governance. They don't understand these principles, or they are not able to demonstrate that they fail this domain. And remember, if you fail patient safety, you're not going to make the exam, because you're not a safe doctor. You might be a good doctor, but you're not a safe doctor. So you'll not reach that RCOG standard. Okay, so for the patient safety, how to tackle this domain is that you need to revise your guidelines, and revise them quickly. You know them by heart. Just revise them quickly from a different perspective, just in case you need to talk about that guideline, how you would be talking. And consent, how to take consent, how to apply the assessment principles for mental capacity, fragile guidelines, Gillick competency, and practice writing the prescription, drug charts, IV fluid charts, WHO safety checklist. If you are using it in your clinical practice, great. If you're not, start using it from now, and so that you don't forget that, and that's a very important safety point. And some of the common drugs, their doses you need to know, such as hyperemesis, gravidarum doses should be on your fingertips so that you can prescribe those drugs. And safeguarding issues must also be kept in mind. So how, if I say that if you want to pass the patient safety domain, you need to reflect and seek feedback. That's very important. Now comes the information gathering part. This is the domain for which, most of the candidates, they spend a lot of time, and sometimes the whole of the time is spent on this. But remember, this is it's a part of part of 2-3 domains, not only the single domain. Okay, so information gathering is divided into 3 components: focus history. And focus history means only relevant history. Don't go into unnecessary details, but do have like a checklist, and do cover all the important things. And that also takes you back to identifying the themes. If it's kind of emergency situation, you may have to skip a few things. You need to stay focused or some information which is provided into the your prompt, into the candidate instructions. You don't need to repeat those things. Okay, probably you can confirm those things, but you don't need to repeat asking and like that. Then comes the examination, and remember, examination also is dependent whether the task needs it or not. If it's a counseling station, you don't need to examine. If you already are provided with examination findings, you don't need to examine. Okay, so the information gathering and the task performance is dependent on the way the things are given in the task. One formula doesn't fit all. You need to tackle each task separately in a different mindset, with a different mindset. So same goes for investigations also. Only relevant investigation. And here, especially for the investigation part, I would give you a tip. So whenever you are saying that I will be doing this, I mean, it's a structured discussion, or you're talking to the patient, that I want you to have, like, for example, it's a patient with placenta previa. You say that I need to have your blood group checked and cross-matched. Why? So just in case you bleed, we'll have the blood in hand. So why component, why part is very, very important. That whatever you are saying or doing, why you are suggesting that. So that's very important when you are asking information gathering also, or you are suggesting some investigations as well. So now how to master these domains is that find someone who can help you, and you have to practice a few opening statements. Like, you start with the open questions, like, for example, when you are asking, you say that, okay, may I know what brought you here today? Or you say that, okay, I've read your GP letter and understand that you're trying to get pregnant for 2 years. It would be helpful for me if I ask you a few questions before we proceed. So you need to master, a few small little sentences. And it's not that you need to say all those sentences, same sentences. You can make a variety of sentences as you wish to, whatever you feel comfortable. Okay. And you need to record yourself, time yourself, record it. You have the mobiles, everyone has the mobiles. Record yourself, audio recordings or video recordings, and then get it reviewed from someone, get a feedback from study buddy or from a mentor or a course facilitator or your senior or your junior, and just get to know about it. And one tip for this domain is that be natural. Don't depict that you are acting, even though you are, but don't show it to the examiner that you are acting. Make it your second habit, second nature, that you ask the questions so naturally that the consultation should sound, the performance in the exam should sound very natural. Now comes a very, very important domain, communication with patients and their families. So before you tackle this domain, you need to know about this ice breaking. We call it ice breaking or ice. So you need to get the ideas, the concerns, the expectations. So does the patient have any idea why she's there? And what is her main concern? Why she's there? She may be having heavy menstrual bleeding and subfertility. So you need to ask, what's the main concern? What has brought? Does she want the treatment for endometriosis, or does she want the treatment for her pain? Or she want the treatment for subfertility, like that. And then expectation. What does she expect from this consultation? Okay, so you need to, and there are specific ways to address these things. Okay, so there are some skills you will be needing to tackle all these things. So you may need to convey the diagnosis to the patient. So for that, RCOG has produced patient information leaflets. All of these are available on the website. So you can just download. With every guideline, you have the patient information leaflets. And I would say, those of you who have recently passed the exam and are planning to take the November exam, start reading patient information leaflets and read them aloud. So you'll get familiar with the layman terms. You will be talking in simple, plain language. And then another thing with communication with patient and families is your engagement, how good you engage them, and how you negotiate, and that comes with practice. Negotiation cannot come without practice. You need to talk. I mean, there may be a patient, she has she had a cesarean section, or she wants to have a VBAC at home. At home. So you need to negotiate. This is your skill. You need to bring it. I mean, you are not going to enforce her anything, but you negotiate and ultimately make her feel that whatever the decision she has taken is her decision. So that is also called shared decision making. And that also comes with practice. Now, what are some further suggestions to tackle this domain? Rehearse difficult questions. There are certain things, I mean, there are people who are very hesitant when they are asking about the sexual history. And that's a common practice in UK. That's commonly asked, and it's taken as a normal part like of any other health concern. So, but you need to rehearse those difficult questions. If you want to ask questions related to domestic violence, FGM, so rehearse those difficult questions and chunk the information in bits and pieces. And don't use jargons. Non-medical language, use non-medical language, simplify yourself. There is a list of terms provided on the RCOG website, which you can download and you can practice that. What is it called? Like, for example, laparoscopy is called a buttonhole surgery, like that. Belly button, blacus is called belly button, uterus is called womb, simple words. And to tackle this domain, very, very important, be empathetic. You can't tackle this domain without being empathetic. Don't be sympathetic, be empathetic. Now comes the fourth domain, which is communication with colleagues, and that's a professional domain. I always say that you need to have a multidisciplinary team. You need to know who are the members of the team whom you will be referring. And if you're telling the patient, you need to tell in simple words: baby doctors, doctors who deal with the diabetes, doctors who deal with the diet, so on and so forth. So you need to simplify the terminologies. Just saying, or for example, if you are in a structured discussion, just saying that I involve multidisciplinary team is not enough. You need to tell which members of the multidisciplinary team you will be adding on to. Okay, and your documentation is very important. Getting the GP in the loophole, because GP sent you a letter, you are closing your station, you have to write back to the GP. That comes as a part of communication with the colleague. Structured discussion, when you are talking with the examiner, that's a communication with colleague part. Teaching stations are nothing but communication with colleagues. And sometimes when you have to tell some patients about the support systems, domestic violence helpline, child care, SANDS, PALS, that's also part of the communication with colleagues. So documentation is very important. The SBAR tool, the your prescriptions, and all those things, they come under the communication with colleagues. So how to tackle this domain? I have one word for that. Think and be ST5. If you know you are ST5, you know who are below you, who are above you, whom you have to communicate. So just think like an ST5. Now comes the last domain, which I feel those people who have passed MRCOG Part 2, they are master for that. Clinical knowledge, applied clinical knowledge, because you, especially if you have passed recently, everything is fresh in your mind. So that is said that sooner you take the exam part 3 after your part 2, better the performance in this domain, because with time it you tend to forget. So what you have to do, you have to revise the notes you have made for your part 2, of course not in depth as much as for the part 2, because RCOG has already tested your knowledge. Okay, so they don't want to test the same thing. If you repeat the same things in the exam, that's not what the examiner wants to hear. If you repeat the same thing, that's not what it is. Okay, so you need to know how you can convey your knowledge in simplified terms to the examiner, to your role player. And these are a few of the tips to tackle this. I would say reflect on your clinical practice. So if you want to like see about the applied clinical knowledge, so just ask yourself a few questions. Do you follow the guidelines? Which guidelines are you following? And if you're not following RCOG guidelines, even if you're managing a patient, you must know if what would it be according to RCOG guidelines. And individualized care plans. Do you make individualized care plans? So if you're making those plans, you'll see, okay, are you covering everything which is required for the patient? Do you request unnecessary investigations? I told you everything should be crisp. Unnecessary details are not required by RCOG. And then the last question is that, can you make your plans more patient-centered? Okay, so these are the things you need to know about the MRCOG Part 3 exam. So now I'm done with this part of my presentation. We'll be practicing the task. So before we practice the task, I would like to take your questions. Do you have any questions or anything which is not clear? Yes, please. I would want you guys, because it's a safe space, and you can unmute yourself and you can ask me. I'm here, right here. Yes. Any question related to an exam? Any question related to the course we have? Because I was getting a few queries, so I'm here to answer all those queries. Please feel free to ask me. Or at least write down your question in the chat box, please. No question? All right. So Swati Sri is asking any fast track course or mock. All right. So I'm going to talk about the courses we have. Yes, we do have the mocks, and I don't call the courses as fast track and all that. So I think I'll straightforward come to the courses we have. Okay. So we have basically three types of courses are available. So these are the courses. The names of the courses could be different. The basic things are the same. Number one, I don't believe in the listener mode. I'm sorry to say that, because MRCG Part 3 is your exam. Probably in Part 2, you can be a silent observer and still pass the exam. But in my opinion, not for Part 3. You need to be vocal. So you need to be active member if you want to tackle the exam. The exam is for you. You have to practice by yourself. So for mocks, yes, mock circuit is there, and this is a private mock one-to-one, Dr. Swati. And if you are well prepared, that you can take. The details I'm going to share about these exams in the mock shortly. So the options we have is the Part 3 OnTarget practice course. This is for the May exam, and we are going to start it from 3rd March. You can book this exam. It's currently discounted. So basically, we'll have 12 sessions, live sessions, the same way we are having it. More, in fact, more interactive sessions would be there. That would be bank only practice. So we'll cover 14 modules in 12 sessions, and depending on the number of participants, every participant will get a chance to present a case. So we'll decide beforehand who's going to present the case. You can present the case and you'll get the feedback straight away. And if we are starting with first module, So we have the live session for 3 to 4 days. You'll have time to prepare and post your voice recording, video recording for feedback on the WhatsApp group and get the feedback. It's always, I have a very firm belief that I am there for your help. All you need to do is to seek my help. I'll be available. So as much as you post, as much as you participate, so I'll be able to help you. So if you practice, as much as you practice, that's going to be helpful to you. And these are the basic things I just told you, how this group practice will help module-wise preparation, and we'll have the group. One of you will be role player. The next time that person would be performing the task. There is no listener mode. Everyone will participate equally. Accessible recordings will be accessible until the exam, and you will be provided with a few important templates and some of the important tasks, and we'll practice the important scenarios from the books and from the different previous exam questions and all that. And personalized feedback would be there. No need to worry about it. And if anyone, 14 stations in each session, no, Dr. Swati. The session is for 2 to 3 hours, and maximum 5 to 6 cases we can discuss, because I'm just going to have a task performance right away, and you'll have the idea that how we do it. Because, I feel that if you practice the number of stations do matter, but I think the quality of your performance is more important. It doesn't matter that you have practiced 200 scenarios, but those 200 scenarios were unstructured. You didn't reflect on your scenarios. You just, got the feedback as all good. That's actually not the feedback. Okay, you do perform, some things are good, but of course there is always a chance of improvement. So we'll have 5 to 6 scenarios depending on the number of participants. So many people, they sometimes it's not possible for them to attend each session. But once again, please, it's part 3, so attend it live, participate, get the maximum benefit out of all this. So some of the people like me who are introverts, this is the course, 1-to-1 e-course. And this course is available, we have the 12 sessions, and this is a completely flexible course. 6 months, it's valid for 6 months. You can subscribe to it at any time you wish to. And especially for those who are going for the November exam, you can join this course, completely flexible, make your modules as you wish to. And I'm open for that. And that's 1-to-1, and one person will get chance 5 to 6 scenarios in about 1 hour, 1.5 hours, and on-spot feedback. And once again, the same performance also, is tested and the feedback is given. And really, so far in my experience of conducting the courses, this course has been the most useful course for everyone. And but of course, the seats are limited for this. And if you want to book this, you need to book it in time. And if you book it, you have to have the sessions within the 6 months, because we have the specified slot. So why this course is the best for everyone is it's according to your needs. The days you are free, or even you can just give me the scenario. Okay, Dr. Rubab, we want to practice this particular scenario. I want to have the feedback for this particular scenario. And once you are here with me, you can send me 2-3 voice recordings, and I promise I give feedback within 24 to 48 hours. Voice feedback, not the written feedback. Voice feedback. You give me the voice recording, I'll give you the voice feedback. So, and this is how this course goes. 12 live sessions are there, but in addition to that, you are completely in touch with me, and you can prepare at your own pace. Now, this is the third option which we have available, mock circuit. So these are basically the 2 sessions. The mock circuit is 14 circuits in one go, 3-hour session, and it's video recorded. After 2 to 3 days, I give you the detailed feedback. do give sometimes some people, they want the feedback, this like, once the circuit is over, they want the fresh feedback, or I can give a proper, conduct another session and give a proper feedback for the mock circuit. And of course, this is done under the exam conditions. You're not shown the key, you just take the 12, like 14 tasks, 14 stations, and this is the mock circuit. And of course, this is also recommended only and only once you are prepared. And those who are taking the May exam, you should book this mock by 15th or 20th of April, so that the feedback of the mock, whatever the feedback you get in the mock, you are able to tackle the feedback also. Okay, so I hope the things are clear to you. Any other question anyone else has? Dr. Rifat, Dr. Shahla, Dr. Eman, Dr. Rana, Dr. Swati, sorry. Yeah. Any question? Anything you want to know before we start the practice? Okay, so Dr. Shaila, the fees are all given on the website. So you can just go and visit the website from there. And they are currently on some discount. And just want to tell you, those people who are from Pakistan or who are Pakistani nationals, they can pay in PKR equivalents instead of paying in the website. They can easily pay direct by the direct deposit. That's going to save them a little bit more. So you can contact on the WhatsApp if you want to. Okay, so Dr. Rifat, mock circuit is, this is, if you read, yeah, this is live. Yes, this is live. And this is basically a one-to-one mock circuit. So you book this mock circuit, I'm there with you, and you are doing it one-to-one. We don't conduct the mock circuit with the group, because once again, I tell you, I believe in sole practice. One person who's taking, you are taking the exam, you should be taking the whole mock circuit. Not that you should be sitting and observing. And of course, this is going to be live. Like we are having this interaction right now. So it will be the same way. It will be live. Yeah. Right. Any other question anyone has? All right. So this can be sorted out later on. Let's come to the last part of our session, and in my opinion, the most important one. So Dr. Eman had agreed for the performance. So Dr. Eman, thank you for unmuting. So I need a role player. I need a role player. Can anyone be a role player? Yes, please. If no one is willing for the role player, I'll be the role player. That's not the problem. Yes. And trust me, believe me, if you act as a role player, it's the most useful way of learning. Once we are done, I'll share a bit of experience of being a role player and sitting on this end of the meeting today. Yes. Who wants to be the role player? No one? All right. Yes. Dr. Rifat, Dr. Shaila, Dr. Swati?
It's okay. I will be.
You will be very good. Okay, Dr. Rifat, I hope you have the mobile with you. I'm going to share the role player instructions in the WhatsApp group. Dr. Ayman, I'm sure that you're not going to see that. Even if you see, it's okay. It doesn't matter. Your performance matters. So this is the role player instructions, right? So what I'm going to do is, Dr. Rifat, you can also, both of you, please remember, these are not video recorded. Your videos will not be visible. Okay. So videos will not be recorded. So you can easily turn on your videos. And I'm going to, yeah, I need to turn on the timer also. Just a minute. I actually, okay, timer, I will just show. So here is the task, right? So Dr. Ayman, are you ready?
Yes, okay.
Okay, so if you're ready, take your 2 minutes, prepare yourself. And Dr. Rifat, please, in the meanwhile, in these 2 minutes, have you received the
Yeah.
simulated patient instructions? Yeah,
Yeah.
please go through the simulated patient instructions. And in case Dr. Ayman asks you anything, you are free to make up the answer. Okay, so this is
Okay.
what actually I mean, you don't have to stick to the role play instructions. The important things I have highlighted, others you don't need to. So Dr. Ayman cannot see the role play instructions. Yes, Dr. Ayman, once you are ready, do let me know. Take your 2 minutes, please.
Hello, I'm Dr. Lancy, one of the registrar in the gynae clinic. May I confirm your name and age, please?
Hello. My name is Sarah Kelvin, and I'm 39 years old.
I understand I understand that you are here today to get your result of the sample taking from the lining of the womb. Is that right?
Yes, doctor.
Okay. Is this is the first time we meet? Is it okay if I ask you a few questions to know more about you? Then I will explain to you the result and what we are going to do. Is that
Yes.
okay? Yeah.
Yes.
Do you have any concern you would like to discuss with me before we start?
Yeah, doctor, I have my periods problem because it's for last 3 years. And so might be this is the reason that I could not get pregnant.
Mm.
I want to know this.
Okay, I will address your concern. Okay, can you please tell me about your period?
Yeah, actually, I have heavy periods, and then it is for last 3 years, and it is for 10 days I have bleed in a month.
Mm. Okay. Have you used any treatment for that before?
Yeah, the GP has given me some medications, but it doesn't work. I could not get any relief from that.
Okay, do you have any bleeding from other areas like from your gums or noticing any bruising at the...
No, no, no.
Okay, and do you have children before?
Yeah, I have one daughter. She's 8 years old.
Was it vaginal birth or cesarean?
Yeah, it was normal.
Okay. Apart from this bleeding, are you fit and well, or do you have any other health problem?
Yeah, I'm fine.
Okay. Do you have any surgeries in the past?
No,
Any allergies?
no,
Do you smoke?
no,
Do you drink alcohol?
no.
Okay. Are you taking any medication for long term?
No,
Okay. Um, uh, anything related to your health you want to add to me?
I'm fine. Just only I have a problem in my periods,
Okay.
and I want to get pregnant. This is my main issue.
Okay. So I'm gonna move to tell you about your report today. I will confirm this is belong to you by checking your name and NHS number on it. Um, before I start, would you like somebody to be with you?
No, it's fine.
Okay. I'm sorry, I don't have a good news for you today. Your report came back as unexpected because it contained abnormal cells, which
Abnormal cells, doctor.
um, the sample taken from the lining of the womb show that the cells are abnormal. It's not a cancer, but if it's not treated after long term, like it may change to be a cancer.
Okay. So, what is the risk of having a cancer with this?
With this type of changes in the cell, it carry the risk of 5% that it can develop to cancer of the lining of the womb if not treated.
So it
Okay.
will affect my, I want to get pregnant, doctor. So it will affect on my fertility.
Actually, what we do in this case, I will discuss with you your options. You can, in this case, you can do nothing, and this can affect you because changes can happen. Second option is having a hormonal coil. Then after 6 months, we do a sample, and if negative, we repeat another sample in other 6 months. The third option is having a progesterone tablet for 6 months. Yeah.
Doctor, I don't want coil.
Okay, in this case, you may try progesterone tablets, and then after 6 months, we take another sample to check if you cured from that. We need another sample, like 2 negative samples. Then we may refer you to the infertility specialist to get pregnant. Okay?
Okay.
Yeah.
So what I have to do now, doctor?
Now, I will prescribe for you the progesterone tablets and to take it for 6 months. Then I will arrange for you another appointment in the clinic in 6 months to have another biopsy sample taken from the lining of the womb. And I will write back to your GP a letter, and I will give you a patient information leaflet containing your about this condition and also explaining your shared decision-making tools in case you want to have a read on that, and if you decided to have a hormonal coil, because it's the first choice, but it's your decision. Whatever you decide, we are here to support you. Okay?
Okay.
Do you want to ask any other questions before we finish the consultation?
No.
Okay, I want to add something else. I would advise you on healthy lifestyle and also healthy weight because your BMI is 32. So this affects the condition you have, and in case you get the negative sample taken from the womb, you will be under annual also surveillance to take a sample because your BMI is above 30. So if you are in the future manage to reduce your weight, it's one of the risk factor for this condition to be cured. Am I clear?
Okay. Okay. So I need to continue to take the tablets after 1 year, or?
Only we give the tablet for 6 months, and they have some side effect like bloating, headache, engorgement of the breast. So after 6 months, we will see if how is the sample will come for the next time we are taking the sample again.
Okay. Then?
Then accordingly, in your condition, if there is any progression in your condition, or bleeding is not stopped, or you change your decision regarding any of these, sometimes like if this condition progress to abnormal cells with more suspicious feature like becoming atypical cells, this make you at higher risk, and accordingly we will discuss your options in time.
Okay.
All right, so you guys are done. You finished in 8 minutes. Still have 2 minutes. If you want to discuss, you can discuss. Oh, you're done.
I finished.
All right. Okay. Thank you. Thank you, Dr. Ayman, Dr. Rifat. So before I ask Dr. Ayman about the reflection, first I want Dr. Rifat, can you please give your feedback? How did you feel as a patient? Then I'll come to Dr. Ayman. Yes, Dr. Rifat, how did you feel as a patient? How did she perform this task?
Actually, because my main concern was bleeding, and I was having heavy bleeding. So did not ask the detail of my periods, and but it affects because I have heavy bleeding. So like anemia symptoms, dizziness, because I have positive dizziness. And also related means any she can ask for the like pressure symptoms might be there is any I have weight loss like that. And
Okay, yeah,
and BMI she recognized later on. It is good. And
that's good. Then
family
she
history,
recognized.
yeah, family history she did not ask me.
Mm-hmm.
And any surgery, yeah, she asked also. And
Yeah, okay,
yeah.
that's fine. That those are the points I've actually noted down. That's okay. Thank you very much. But overall, how did you feel? You feel comfortable with the doctor?
What I should say?
All right.
Yeah.
Thank you. All right. Thank you. Thank you. Yes, Dr. Ahmed. Now, can you please reflect on your task? How do you think that you performed?
I think I missed some point in the history. She did mention about family history, which is very, very important in this lady.
Yeah,
And
yeah.
uh, it's my first time to practice like this, so I
Oh,
feel
but
so.
if it's the first time to practice, I appreciate you. If it is the first time, it's very good as a first timer. Okay. What else?
I'm not sure. I think
Oh, okay. All right.
I
So
to
now
tell
let me
me.
give you the feedback and let me give you the feedback. And please, none of you should take it personally, Dr. Ayman, Dr. Ifat. Don't take it personally. It's just a very a neutral feedback, and the purpose of the feedback is only and only the improvement and nothing else. Okay, because I'm a little bit harsh on the feedback, so sometimes students they mind that, but I'll try to be very lenient with you, but on the on-spot feedback, right? So overall, Dr. Ayman, you performed very well, keeping in view, as you said, that this was your first practice. So it was good because you didn't have any simulated patient instructions. And the most important thing is to volunteer and come forward and practice. Both of you, I really appreciate to take this brave step. Now, what I could see from your consultation, you do have an idea how the consultation is done. You did follow the consultation model. You had the good introduction. You build up the rapport with the patient. You did set an agenda also that you're going to talk about the diagnosis and things like that. And you started with the open question. That was very good, because when she said that she has periods concern and she wants to get pregnant, you started with the open question related to her periods. That's very good, and that's very, I would say, encouraging. But the thing is, of course, you missed a little bit of the things. So mark my words, whenever a patient comes with heavy menstrual bleeding, you need to determine how this is affecting her quality of life. So the conditions which are in RCOG curriculum, like urogyne problems, like these pre-malignant conditions, most of the conditions in the gynae, how it is affecting her quality of life. If you had kept that point in mind, then you would have missed that this was affecting her, how badly this is affecting her, how much does she bleed, what does she do for that, what does she, well, I mean, how does she tackle her periods problem, right? And you did ask about the bleeding from the gums or bruising. So please note here that never ever ask two questions in one sentence. Ask whether she bleeds from somewhere else. Does she have easy bruising in the body? Like this. Break it into small sentences and ask simple. You asked about the obstetrical history, all those things. I mean, the points you had asked. The main thing which actually I have highlighted here was that, okay, you have taken you have gathered the information, which was very relevant, and you did it in about 2 minutes and 45 seconds. That was very good, very good. Keeping in view that you didn't miss much of the things. You missed something which you had covered in the end because your time was done. The thing is, you should have asked her, what has she done so far? That's the point which you had missed. Because what, I mean, she has the bleeding. So what is the recommended treatment for heavy menstrual bleeding in NICE guidelines is Mirena. right? But what has she done so far? In her script, it was given that she was offered to take the hormonal tablets, but she refused and she does not want to have a coil. But it's written in the script that if some doctor explains it properly, she will be happy to take the pills as well as she might agree for the coil also. So this station, it had two types of themes. One was to break the bad news, which you did eventually. I'll come to that also. And the second part was the negotiating with the patient. Even though you have to agree to what she's saying, I don't say that you don't need to agree. But if she said that she does not want IUCD, you said, okay, no problem, you moved ahead. Whenever a patient is saying no for a significant, simple treatment, pause for a second and just ask, may I know the reason why? Okay, your role player was very good. She told you, but you just pause for a second and ask her, may I know the reason for why? Okay, and like this. And then when coming to breaking the bad news, that was okay. You followed, in fact, it was good that you followed the spikes model, setting, perception, and then asking the patient. And you told her about the news also. You told her about this also. But the thing is, I have a different viewpoint for tackling these sort of stations. When you have identity, did you, okay, Dr. Ayman, did you identify this is a breaking bad news station?
Yes, yes, I did.
Yeah. So there are two schools of thoughts about breaking the bad news. One school of thought says that break the bad news as you took some history, and then you broke the bad news right around 4 minutes time. It's basically without ATPR, so it's not a very bad news, but it is a bad news. It is bad news in the sense that she wants to conceive. She's 39. She wants to conceive, so kind of a bad news for her. The thing is, they say either you break the bad news right in the beginning. So if you break the way you broke, it was fine. She did not react. There wasn't much of the things. And you talked about that there are the abnormal cells, but that's not cancer. That was okay. But the wordings could have been better. I'm going to tell you how this can be talked about. So how you are going to break the bad news to her is that, I mean, I'll just give you a little bit of an idea how you can do that. When you start, you say that, hi, I'm Dr. So and so, the doctor in the clinic for you. I've got your ultrasound report and the sample we took from your womb. I have these reports with me. I'm going to discuss the reports with you. Would you like someone to be with you? Okay, so this is how you are setting. And then she will be like, no, or maybe she'll get alerted. And then you're like, okay, so then she like, okay, what is the news? What is the result? Because if you see in real life, you have a patient who comes to you, he wants to know the results. This scenario was straightforward, but if a patient comes, he wants to know the result, and you keep pending it for 5 minutes, 6 minutes, though 5 minutes and 6 minutes would be very difficult for her. And then you straightforward, you say that, unfortunately, the results are not what we had expected. Okay. And the results show that your womb lining has some abnormal cells, and and we need to do something about it. And then the patient is going to ask you, is this cancer? Just tell her this is not cancer. This is called endometrial hyperplasia. I know this is a term which will be difficult for you to understand, but I will provide you with written information so that you can have a detail about it. And then she'll be shocked. She may ask you, what next? So now is the time you say, as we are meeting for the first time, as I have not seen you, so now let me before I make a management plan or to guide you further, I need to ask a few questions from you to know more so that I can make a proper plan with you about your management. And then you start asking the information gathering. If you go like this, it's going to take 1 extra minute, but it's going to give you the command over your task, because sometimes the patient may be very irritated that the doctor is not telling me what's the thing, and you actually managed it quite well. You finished the task in well in time, but sometimes some patients may be very edgy. They want to know everything so quickly, and then you start asking the questions, and then you start tackling. So missing that part, what she has done. And now once you have taken the treatment, now when you once you have taken the all the history, now when you're coming to the management part, that's how you have to start. So then you're like, okay, so now coming to how we take things further onwards. Okay, so there are different treatment options. The best option is to have a coil inserted inside your womb. And she says she doesn't want. Then you ask why she doesn't want, or if you had asked that in the information gathering at that time, maybe you have already addressed that. All right, then if she doesn't want, then you tell her that this is the second option is doing nothing is not the option. That's the third option. The second option is if she doesn't want to have a coil, tell her that you can have tablets. And these are the tablets, though those tablets, you need to take them regularly. And all the information, if you have read the patient information leaflet for the endometrial hyperplasia, you can speak about it. You can tell the best way to and the best treatment for this condition is to have a coil inserted, because there is more likely chance that the condition will not progress, but in fact regress. And when she asks what is the chance of it becoming a cancer, just tell, you said 5%. Please try to avoid the percentages in the exam. Just tell it's about 5 in 100. Okay, talk like that, and then tell how you are going to do. And then you'll say, I know there's a lot of information, Sarah, but please feel free to ask me if I'm not clear for anything. Whatever I'm talking, I'll provide you the written information along with. And then, so this is what you have to do. And then she'll be like, maybe I'll think about the quiet. And like, okay, if you want to decide about it, you can go home, discuss with your partner, talk to someone, and if you want, change your mind at any time, please come back to me. So I am writing down what all we have discussed today, and I'm writing back to your GP. I'll be prescribing you with these medicines, and I'll give you the follow-up plan that you will be coming for multiple biopsies. And then talking about the fertility component also, here you need to tell, this is important. I know this is important for you, but keeping in view your age and your condition, I need to refer you to the fertility specialist doctors. But before that, we need to start the treatment for it so that your bleeding is controlled, you are under control. And like this, the way you your closing was very good, Dr. Ayman. I was like, I put double tick on it. You talked about the patient information leaflet. You tried to summarize. And if you are left with some time, you can just tell her, okay, so is everything clear? Do you want me to repeat anything? And in fact, if you have, talked about all these things, time will not be left. There will be, you need to squeeze in. So anything, Dr. Ayman, you want to say about my feedback? Dr. Rifat? Yeah.
Yes, I want
was
to know if this is a real exam and how you score me.
Yeah.
You can,
No.
even if I failed, I'm open to it. I just, it's okay. I want your frank feedback, like as station, how you score me in exam if I'm a
Yeah.
candidate.
I'll tell you about the scoring. I've given you the scoring also. So in the communication with the patient, you were very calm. You were very good. Your patient was engaged with you. Communication with the patient, I would say that you have passed the domain, in my opinion. Okay. The other domains are borderline. The information gathering, the asking why she doesn't want that, and what she has done. Applied clinical knowledge, okay, that is also borderline in the sense, because could have been a little bit more, because if you have tried to convince her to complete, to come to the Mirena and tell her a little bit more about what the condition is, how it can affect. Patient safety also, of course, you didn't prescribe anything unsafe for her as such. But still, I would just give you one here, borderline, because there were some things, of course, you missed quality of life aspect. You missed what the treatment she has taken. You missed probing in why she doesn't want. So like this. So borderline, not a fail, borderline, and keeping in view the first performance good. So time management is like you should not exceed the time, and you should not finish before the time also, because if you finish before the time, until unless you are extremely on target, you'll miss some things. Okay, so anything else other people want to add into it which I might have missed, or anything uh, you want to say about Dr. Aman's performance? So this was the simulated patient instructions. So this is the about the domains. So you can, I just talked about it. So most of the things you did cover. And another thing I want to tell you here is whenever I chosen this topic to discuss endometrial hyperplasia, because in my opinion, more than the endometrial cancer, this is the hottest topic for MRCOG exams, because it is a precursor of endometrial carcinoma, which is the commonest cancer. And when you are dealing with this case, try to identify the risk factors, or if she asks you, why do I have it? So you tell her there are a few factors which can lead to, which puts you at increased risk. So you should ask her about whether she has diabetes, she is obese. In her case, she has obesity. And then as she had irregular bleeding, you needed to establish the cause of her increased, like if she might be taking some estrogen treatments or anything like that. Okay. So these are some of the risk factors for hyperplasia. And this is from the guideline, hyperplasia with atypia. So risk of progression is very low. LNG is it has the higher risk of regression. So duration and follow-up is like at least 6 monthly follow-up she needs to take, and you need to tell her why she needs to have follow-up, because if she does not have follow-up, there may be a chance that it may become cancer. So you be honest, be open, don't scare the patient, but don't lie to the patient also. And if she can tolerate, she can use it for 5 years. And before she is discharged from your follow-up, she needs to have 2 consecutive biopsies 6 months apart. So this also you need to convey to the patient. Once it regresses, we confirm that this is all okay, then we can discharge you, and then you can refer you further. And this is the flow chart, which is from the Green Top guideline. Very, very important one. And recently, RCOG has published this patient information leaflet also about endometrial hyperplasia. So I thought it's good for you guys if you can go through this endometrial hyperplasia leaflet also, because this is in a simple language, simplest language, and you can speak about it. And how you practice the information leaflet is like, just keep talking to yourself if you have time. Otherwise, you can have someone to be with you. So that concludes our free webinar. Thank you very much for your time. And I hope this was helpful to you. Thanks.
Thank you. Thank you, Dr.